Good afternoon. Welcome to the daily briefing at St. Clair County EMA, where Chairman Mark Kern is with us today, and Sam Bierman. And Sam, you've got a lot of numbers today and got some explanations that
Yes.
we think that we'll be able to explain these numbers. And when you called me today, calm down, take a chill pill.
Yes, before we email them over to you, I want you to have some explanations so you don't fall
It's
out of your
like
chair.
throwing your hat in the door before you come in.
Exactly.
To see if it comes back at you. Yeah.
So before we start with the numbers today, I want to give an explanation of why our numbers have changed so drastically. We received a memo from IDPH earlier in the week stating that there was a problem with some of the data reporting. Today, we received another memo that said that they had checked into the data backlog problem and that they had cleared the issue, but while in clearing the issue, 149,273 test results were processed. So when I read the state numbers today, you will see that there are over 5,000 new positive cases for the state, and that is the backlog that IDPH was talking about. Now that it is fixed and has been cleared, there have been some system upgrades done to the data reporting system that IDPH does use. If you would like to take a closer look at the memo that we received, it is on the IDPH webpage as well as the EMA Facebook page. So for St. Clair County totals, so far we have tested 67,440 residents, which is an increase of 1,927 from yesterday. We were at 6,167 positive test results, which is an increase of 126 from yesterday. And that does include both males and females from under the age of 1 up to their 80s. And we are at 6.5% for our daily county positivity rate. We are at 61,273 negatives, and we are adding no new additional deaths today for our county, so we are still at 175. For those who have completed the IDPH required 10-day isolation period, we are at 5,328. For state totals, 4,309,941 have been tested. We are at 245,371 positive test results, which is an increase of 5,368. And for deaths, the state is reporting 8,143, which is an increase of 29 from yesterday. For hospitalization numbers, the first set of numbers I'm going to give are for hospitals that are in St. Clair County. And currently we have 52 patients that are admitted due to COVID-related reasons, and currently 4 of those are on ventilators. For regional numbers for our hospitals, we are currently at 98 patients admitted due to COVID-related reasons, and 9 individuals on ventilators. For our congregate living facilities that are in outbreak status, which is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, as we've done, we are only going to announce any facilities that have changes. Aperion Care Center in Mascoutah has 4 cases, which is an increase of 4 cases. And I would like to make a side note. 2 of those are recent, and then we just found out today that we had 2 back from April and May that we were not aware that were attributed to that facility. So they did not have all 4 recently, but we do attribute all cases to the facility when we are made aware. Caseyville Nursing and Rehab has 32 cases and 2 deaths, and that is an increase of 3 cases for that facility. And finally, Cedar Ridge of Lebanon has 80 cases and 16 deaths, and that's an increase of 1 case for that facility. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So that dump from Illinois Department of Public Health, the dump of all those numbers, the percentages really, nothing alarming happened.
No.
Our county positivity is 6.5%. The regional positivity remains at 9.3% today. But the number that gets me today is that we are up 11 COVID-19 related patients in St. Clair County hospitals from yesterday. Yesterday we were at 41. Today we're at 52. And then regionally, we're up 14. That's a number that the hospitalizations are really a telling number, and that's why it's extra important that people take care of this Labor Day weekend and remember that you don't want to end up in the hospital.
No, and as you said, when you do a quick look at the numbers, which is why we gave the explanation before we did the numbers today, when you see almost 150,000 results, you think, oh my goodness, that's going to sway the results, far one way or the other. But as you said, it doesn't affect our numbers too much. But hospitalization numbers that we have, not only for our county, but for our region, is a pretty telling sign of where we sit, especially for those who are severely affected by it, not just those that, are at home, who are able to recuperate at home, who have their 10-day isolation period and then are able to return to normal life. It's our hospitalization numbers that we keep a pretty close eye on.
And it wasn't that long ago, we had no patients on ventilators for quite a period of time. Today, we've got 4.
We do, and it seems to creep back up, and then it'll lower again, and we'd like to keep it on that lower end.
Let's hope we go
Yes.
that way.
Well, Sam, I wanted to just touch on that, the 4 cases at the one long-term health care. I just wanted to reiterate that when you say that they were from back, that they weren't reported to you, and that's why we didn't have them then. That was just found out. Then you brought it to the attention. That's why they're being added in now.
Yes, and sometimes that happens. If we get a positive test result and there is no facility attributed to it, we don't know that person is from a long-term care facility, whether that be a staff member or a resident. So when we find those and are able to attribute them to a specific facility, we certainly do that because we want the numbers that we provide to be as accurate as possible.
Very good. Thank you.
And those facilities are supposed to report those numbers too.
Yes,
It's
yes.
their
And
duty.
we look back, and that was back in April and May. A lot's changed since April and May. I feel like we're have a very good open line of communication with all of our long-term care facilities. And in the beginning, when we had asked them to report their COVID test results, positive or negative, as well as any deaths that they had every day, that was when our long-term care facilities were trying to figure out how they were going to handle.
Stressed.
Yes, they were stressed. Not only with sick patients, sick staff members. They were low on staff. Some facilities were having a hard time getting their laundry done simply because they had staff out. So there were a lot of things that were going on. But I think not only as a health department, but as our long-term care facilities, we've kind of figured out how to handle these issues, have our feet planted a little more firmly on the ground. And so, we're moving forward the best way we can.
Very good. Thank you.
Great. Thanks, Sam. We'll move into the zip code report at this time. In 62059, we remain at 11 today. 62201, we go up 2 to 224. 62203 stays the same at 185. 62204 stays the same at 128. 62205 goes up 5 to 188. 62206 goes up 5 to 414. And 62207 goes up 1 to 231. 62208 goes up 11 today to 374. And 62220 goes up 13 to 483. 62221 goes up 9 to 578. 62223 goes up 10 to 350. 62225 goes up 4 to 27. 62226 goes up 8 to 641. 62232 goes up 8 to 167. 62239 goes up 2 to 85. 62240 goes up 2 to 31. 62243 goes up 2 to 87. And 62254 goes up 10 to 212. 62255 stays the same at 16, as does 62257, remains static at 32. 62258 goes up 8 to 156. 62260 goes up 7 to 113. 62264 stays the same at 85. 62269 goes up 14 to 487. 62282 stays the same at 8. 62285 goes up 1 to 70. And 62289 stays the same at 6. And as we said, the regional positivity remains today at 9.3%. Sam, have you got an update on the testing sites that maybe we can talk about?
Yes, this weekend we have both Saturday and Sunday at Belleville East, and that is all day from 8 a.m. to 4 p.m. It's in the back parking lot down by where the students park, and that will be both Saturday and Sunday.
Great.
And then next week, we also have testing on Tuesday at Hollywood Heights Fire Department. And that is from 10 a.m. to 12 p.m. with a lunch break for our staff, and then starting again from 1 p.m. to 3 p.m.
And citizens that have been going to those testing sites have been seeing the results come back fairly quickly.
They have.
So it's a good way to get tested. It's easy, especially both of those locations are convenient, and so we hope
They are.
everybody gets out.
And as always, no cost to the individual. Insurance is not necessary, but if you do come, we do ask that you wear a mask when you come to the testing facility.
Okay.
And we got the notification today from Mayor Suarez from Fairmont City. They've got a date coming up next week that we'll be posting on our site. So
Okay.
we'll stay tuned to the EMA page, and we'll have those sites posted.
And speaking of mayors, I know Mayor Eckert came out with a briefing a little earlier in the day today. He is cautioning people to be careful, kind of reiterating what we say here every day about wash your hands and wear your mask and watch your social distancing. And of course, we reiterate what we're told from the CDC and from the Illinois Department of Public Health. So if we all stay on the same page and do the same things, maybe we won't see that same spike that we got after, as you pointed out yesterday, after Memorial Day and after the 4th of July. And actually, if you remember, St. Patrick's Day.
Yes.
When this first started, we saw that was really the launching of our numbers, was when people went uptown and enjoyed St. Patrick's Day without any social distancing.
Well, and again, a lot of the mayors, and we say that each time, the community leaders have really been supportive, and I was glad to see the mayor today release that just a little while ago, was supporting the cause, because as I say all the time, we're all in this together, and together we will get through this. And our regional rate, as you said, stayed the same, so I'm happy about that. I mean, I want it to go down, but I don't want it to go up. So we keep watching those numbers. But this weekend, though, will be a tale of the tales. Our positive count, the daily county positive rate 6.5. So we're holding our own, and I know it's stressful for everybody. But Team St. Clair together, as we've said now for approaching 180 days, has been a chore. But we know you've all been with us all along, all of the Team St. Clair people, and to kind of show you that we had a young group send us their message on how they're fighting this COVID-19. How they can practice social distancing, and we want to give a special thank you to the Expressions Academy of Dance of Belleville, Illinois. Take a look at this, and then we'll be back with Daisy to translate this into our Spanish community, and we'll be back here tomorrow afternoon. Have a good holiday, a weekend, and be a safe one. Thank you.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, jocks, bears, cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and lock